It was a drastic change. And then we came to Colorado at Peterson Space Force Base. The Space Force is a new, I'm sure everyone knows now, it's a new branch of service that you can go into, but they are very limited in what they have. So me as an Air Force member supports the Space Force for medical reasons, kind of like the Navy does for the Marines. So same models, different branches. But yeah, we've been here. We moved here about 3 months ago. We're loving it. The weather is great. Super bipolar over here, by the way. It'll be bright and sunny, and then rain for 2 hours, and then switch back to sunshine. So
Today on the PTA Plus podcast, we are diving into the other side of physical therapist assistant through the lens of the military. Our guest is Joel Medina, Staff Sergeant in the U.S. Air Force, one of the few licensed PTAs serving in the 4J Specialty Code, a role where clinical care meets command responsibility. With nearly a decade in the military and 3 years as a licensed physical therapist assistant, he's held positions at Lackland, Eielson, and now Peterson Space Force Base. As an NCOIC, he's not just running a clinic, he's mentoring, scheduling, advocating, and even casting orthotics when needed. Whether it's battlefield acupuncture, front desk logistics, or bridging the gap between PTs and patients, his work goes beyond the treatment table. Also, the newly appointed APTA Federal PTA Council representative, and currently pursuing his bachelor's degree with hopes to apply to the prestigious Army Baylor DPT program. So without further ado, let's get to the show and welcome Joel Medina. Hello, Joel. Thank you for joining the show. I appreciate your time.
Hi, thanks for having me.
Yeah, absolutely. So welcome back, everybody. PTA Plus, Katie Sutton, you all know me at this point in time, but today's guest is Joel Medina. And Joel and I met at Leadership Congress. It's been, I don't know, maybe 2 weeks now. Has it been a full 2 weeks?
I think so. Time's just gone by me already.
I know, right? Yeah. And I was there in DC for quite some time. I think I got down there like on a Tuesday, and I was at the Future of Rehab Therapy Summit for a couple days before we even started on PTA Council stuff on Friday. And then, of course, House of Delegates started on Sunday. So I felt like I was there for a very long period of time. Lots of things that were happening all around Washington, D.C. and APTA headquarters, and of course, where we always meet for Leadership Congress down there in Washington, D.C. So lots of fun things, lots of opportunity to see people that I haven't seen for a while. So that was your first Leadership Congress, right?
It was.
Yeah.
Very exciting.
Yeah, cool. Well, I'm glad. I hope that you had a good time, and I hope you learned a lot.
Yeah, it was a lot of information to take in, but it was informative, and I got to meet a lot of great people.
Good. So you and I, we were put at a table together. So at the APTA's PTA Council meeting, we always meet the Friday before House of Delegates as a council, and so we did. We all met up that Friday, and they gave us some activities to do so we could get to know everybody a little bit better. We had all of the PTA Council representatives in one room, got lots of updates from American Physical Therapy Association as to what they're doing, the wins that have been happening in different states, the wins that have been happening for PTAs all across the US, lots of fun and interesting things. And so our leaders in the steering group, they kind of split us all up. Probably so we didn't sit by people that we already knew, right? And so they split us all up, and you happened to be at my table, and we got to talking, and you explained to me that you are the new APTA PTA Council representative for APTA Federal. So
Yes.
you are representing PTAs, and I kind of do this in quotes, and not everybody on a podcast can see the quotes, but PTAs look very different in the military as compared to what they look like in civilian life. And so you and I were talking, and I'm writing down notes feverishly, and I'm writing Joel, and I'm writing podcast beside your name, because I'm like, I really needed to have you come on and talk to all of our audience about this, because the majority of our audience is PTAs, of course, but I don't know how many are listening from the military. side, but it would be really nice to offer some perspective because it's way different.
Yeah, absolutely.
Yeah. So I'm going to stop talking because everybody who knows me knows that I can talk for a very, very, very long time. So I'm going to go ahead and let you, Joel, introduce yourself. Tell us a little bit about who you are and what you do, what your current role is.
Yeah. So I'm a staff sergeant in the United States Air Force. I am what they call a 4J, which is just an career field code for physical medicine technician, is what it's called. But I'm also a licensed PTA. And I'm currently in Colorado Springs at Peterson Space Force Base.
Awesome. Thank you. So let's go ahead and start with the basics. Tell us a little bit about what the life, like a day in the life, looks like for a 4J. And it feels so weird for me to like refer to you as a 4J in the Air Force.
Yeah. So day to day kind of looks a little bit differently. We can be heavily involved in patient care. A lot of what we do throughout the day is just involves readiness as well, just to be fit. Some of that time is cut out to go to the gym to be physically ready in the time that we get asked to deploy and or TDY last minute. Um, but we're also hands-on. We do have contractors in our, we call them MTFs, military treatment facilities. Um, but the way everything is structured, and we can kind of get into this a little bit later as well, we are essentially ran by DHA, which is Defensive Health Agency. So they kind of essentially dictate what we can do and how many patients we can see in a day, on top of maintaining these readiness standards, in order for us to just be on top of everything. So it kind of varies day to day. It's hard to have like a set schedule, but we heavily rely on our contractors who are great, and try to offload that pressure of seeing patients on a day to day basis. So it's very moving parts. Um, so it's kind of like the day to day feel. We have certain programs that we have to upkeep, patient advocacy. We are medics first, so we have to maintain clinical competencies, and sometimes that involves stepping out and just focusing on the patient, whether it be their plan of care, or sometimes we can get asked to go help a random clinic's front desk, that's not even physical therapy related.
Duties is assigned, right?
What's that?
Duties is assigned.
Yes,
We
yes.
even have those in civilian life too. So
Yeah, essentially. And then we even handle our own referrals that come in. It's kind of like all encompassing, but it's very stressful, but also very rewarding in the end, when we know the patient is getting taken care of. So super super up and down.
yeah, you use a lot of fancy acronyms, which we like acronyms in physical therapy. That's something that's near and dear to our heart. But you have a bunch of new acronyms that I've never seen, obviously from the military point. So there's another role that you carry, and I might be saying this wrong, but it's NCOIC. Is that right?
Oh yes.
What is,
So
explain.
yeah, if I do
Explain
ever say it like
like
in
a
public.
5-year-old, please.
Yeah. So NCOIC is, non-commissioned officer in charge. Essentially, the way structure works in the military, as far as the clinic aspect just goes, or just anywhere, the higher ranking, the more responsibilities, the more roles you have. With those responsibilities and roles, kind of also dictates how many patients you can see throughout the day, because you have to upkeep with so many clinical tasks, just Air Force related task readiness things. Um, so with that role, all entails is I will still see patients, but any like clinical issues, because we don't have, in the civilian sector they have a clinical manager essentially, to handle kind of like anything that might go wrong, with patient referrals day on day and stuff. The NCOIC kind of fills that role, that's equivalent to like that civilian side.
Makes a whole lot of sense. Yeah.
Yeah, so certain duties are similar, just with different aspects of the job. That's all with that comes with the uniform naturally. But yeah, it's super can be super stressful as well at times, but we all get through it.
Yeah, of course. Now, you mentioned that you are actually a licensed physical therapist assistant, but you also have mentioned to me before we got on air that there's only about 8% of 4Js that are technically licensed physical therapist assistants. Is that accurate?
Yeah, so as 4Js, we are taught um, just a regular program is for PTAs 2 years. In the military, it's about 5 to 6 months. So we are just brought all this information that's condensed, not even cutting the tip of the iceberg, what a PTA is, actually proficient in and very knowledgeable in. We have to have all this information brought up to us, and even though we get to our first base, we still have like on the job trainings. So we don't like go directly into patient care, but we still have on the job trainings, and some of those on the job trainings are led by actual contract PTAs as well. So that it's great because the knowledge that the civilian side holds is can be very broad from what we're initially taught. So having that aspect is amazing when it comes to training. But yeah, so 4Js is myself. I came in as a 4J when I actually got through the program. CAPTI actually discredited the program, and I had to go to school again. So it took me about two and a
Wow.
half years to actually finish my schooling and then sit for my board to be certified.
That's
Uh,
crazy. I was just going to ask you like what kind of roadblocks that you had to push through, but that's a huge one.
yeah, there's not many programs. I think there's only about one or two programs that are willing to accept those credits that we earn through the military. We call them METC,
Okay.
the Medical Education Training Center at Fort Sam in Texas. But there's one program that I know of called Lake Superior College, and they are based, I want to say, in Minnesota, if I remember correctly. They essentially what they do is they get those credits that we earn from METC, and we have to take an additional, I believe, 6 or 7 classes. The last class being like a refresher course over the whole program, and then once we pass that, we are able to sit for our license. There is only one, and I'm not sure if I can speak to this. I believe there are some in Colorado, and I won't drop names because, like I said, I'm not sure how out it is, but there is one being worked in Colorado that we can go to in person. That we might be able to continue with our education, and then once that program is completed, we can sit down for our boards. So more to come on that, hopefully. That'll be open to all military members, not just Air Force. That'll be all
Mm,
for
great. Yeah.
Navy. So yeah, definitely a challenge.
Yeah, yeah, no, those are huge barriers. And I mean, I want to know in what ways that the civilian world can maybe support getting more of those military PTAs or 4Js in your case, probably labeled something different in each military branch. But it seems to me like this is such an easy bridge to gap, or such an easy gap to bridge. Sorry, I said that totally backwards, but um, so I guess what I'm saying is shout out to like PTA programs out there. Like this is a problem we can solve, right? I
Yeah,
mean, I feel like this is something that we can easily fix. That if there are people in these positions, these 4J positions or fill in the blank in other military branches, like we already have bridge programs for PTAs to go to DPT school. So why can't we come up with a solution to get our military members licensed?
yeah,
You have a ton of experience, and to me, when I think of leadership, those coming from military into the profession officially as a licensed PTA or whatever that looks like, because I don't know that that officially brings you into the profession. I feel like you're already in the profession, but that's another discussion for another day. This is complex and layered, but you bring all this leadership experience that we want. Like we need that. So this seems like it should be something super easy to fix, in my opinion.
Yeah, and you'll have it's a hit or miss, right? You'll have a 4J or a 68 Foxtrot, which is the equivalent to an Army physical therapist assistant, that will be in for 5, 10 years plus, doing this job and without a license. So the issue is they have the knowledge, they have the capabilities, to be able to perform just as much as a civilian side without the actual license, and
Mhm.
trying to get them to engage and go through these programs, when their mindset is, I'm already doing the job, why do I need a license? Unless
Mhm.
they want to make this their career. In the end
Hmm.
game, when they get out, which would be super beneficial, and the military pays for them to get their license. Um,
Yeah.
I believe, sitting for your exam is close to $500. Is that
It's
correct?
a yeah, it's approximately $500. I mean, that
Yeah,
would depend on like your state license fee and
right.
your Prometrics fee and things like that, but yeah, about
Right,
that.
yeah, so $500 plus, and the military pays for that.
Hmm.
So that's not something out of pocket that we have to fork out. The military is, hey, if you want to continue your education, go for it. We'll give you the tools that you need to be able to do what you need to do, professionally and just for self development. Honestly, so it's not a bad gig. It's just trying to flip that mindset, into, hey, this can be your backup plan when you get out of the military. Continue working as a PTA on the civilian side, which is, I
Yeah.
think, is great.
Yeah, and I think that that would be something that we would want to retain. Again, that person who brings knowledge and skill and already has that clinical background and has that leadership, like that's something we want to retain in our profession.
Yeah,
So to me, it feels like it would be, to me, it feels like it's a no-brainer for APTA and for the profession to kind of put resources behind this kind of idea of getting our military individuals into licensed positions once they choose to either exit or, as you are, licensed in the current Air Force, right?
yeah, yeah. So, and then speaking on the 8%, so I believe in my career field in the Air Force, there are about 280, 4Js, and only 8% of us are licensed. So just about like a little over 20, um,
That's
which is
crazy.
which is crazy. But again, it's that aspect of, these people that have been in so long. They're like, why do I need my license? Like, I'm already practicing. So
Yeah.
yeah, it's just that mind shift that we have to implement.
Yeah, definitely. I have so many different directions that I want to like take my next couple questions for you, but I'm going to try to rein it in because I
Yeah.
can get a little bit distractible here. So something that might be a little surprising to people who are listening. I already knew this, but essentially what you're saying is the majority of our military members who are practicing as physical therapist assistants or 4J or did you say 68 Foxtrot?
Yes.
Okay,
Uh,
that's just a really cool
yeah.
that's a really cool term. But so whatever these titles are for them, the majority of them are not licensed. So
Correct.
what does that dynamic look like? And what kind of things have you found or faced when you're interacting with civilian PTAs? Like, what's this whole dynamic look like?
Yeah, so, a lot of civilian PTAs are either contractors or GS employees, which means they fall under like a federal section and they work for the government essentially. So it it's weird, right? Because we still are working under a licensed physical therapist, and the military allows us to practice certain things that a civilian PTA cannot. For instance, we can do stitching removal and wound care debridement. Um, we also have the capability of branching off, still within our career field, but we can make splints and casts for postoperative people or just people who have fractures. Anything that fits that criteria, and we also can work in a occupational therapy setting,
Hmm,
uh,
interesting.
without having the quota. So in a lot of bases have kind of that dual dynamic where they'll have occupational therapy or occupational therapists coming in, and we have the capability of treating both. The problem is scheduling. Obviously, contractors are, they work under their license, so we don't want to put anything at risk with them.
Of course.
So we just have to be careful about who we schedule, who with, or if they are with that patient, who performs what on that patient. So there's just this kind of things that we're able to do only because we are under a federal section. Um, and we do have certain guidelines from our chief functional manager, who kind of oversees all of our 4Js and lets us know, hey, like, here's some updates. You guys can and cannot do this, or you have this capability to branch off here. He kind of sets those standards along with some other higher ups, and they're very closely following the guidelines of a civilian PTA. I think our reference is actually the House of Delegates revision.
Yeah. Hmm.
So it's very closely monitored, with the exception of a couple things,
Okay.
only because we are under that federal section. So it's a very different dynamic. We just have to be careful of how we do it. But we still get trained by licensed and certified through these doctors that we were able to perform those capabilities.
So there is still like a checkoff system on competencies. Like they're
Yes.
not like, here's your 5 months of training. Good luck.
Yeah.
See you later.
Exactly. Yeah. So one of another interesting thing. Have you heard of a BFA, battlefield acupuncture?
I have actually heard of this before, but please go ahead and explain a little bit deeper for our audience members.
Yeah, so BFA is something that the military actually heavily performs on our patients. So essentially, like a baseline is you just start with 5 points in the ear, and then you just kind of puncture a little needle in specific 5 points. It's supposed to help reduce and relieve pain. As 4Js, we have that capability of performing that on patients. I'm not sure civilian side how, if you guys are able to perform that. So yeah, so
I
that's
would
not the
venture to say that the majority is a no on that. I mean, I know in the state of Ohio, we're not allowed to do anything with it would probably be the closest to like dry needling, and we're not allowed in Ohio.
gotcha.
And I don't know. I'm sure somebody will comment once this is posted that the rules and regulations from other places, but I can't think of any place that does that PTAs are allowed to do dry needling.
Yeah, so same thing with BFA. We're certified, and we practice, and we have to be monitored for the first however many patients, just specific to your MTF standards, your military treatment facility, and after that, you're pretty much you're set to go on your own as long as your therapist approves and everything. So yeah,
Yeah,
just
it's interesting hearing you talk about like all of these variations and differences in what PTAs or 4Js or 68 Foxtrots can do in the military. And I know that I've had a lot of conversations with PTs at the level, at the APTA level about the military model, because it does seem like even the physical therapist in the military model have slightly different directives, have slightly different skill sets that they can do. I think they're viewed a little bit more as a um, practitioner or a versus a physical therapist within the allied health model. Now, so hearing you talk about some of the things that PTAs can do makes a lot of sense, considering what I've learned to be true of physical therapists in that same military model.
yeah, they have a lot of capabilities and direct access to just certain things that can take 2 3 weeks to perform. Patient comes in, and in a clinical setting, if you're worried about a fracture or suspected tear, um, correct me if I'm wrong. I've never worked in a civilian um, physical therapy setting, but the physical therapist tells that patient, okay, you need to go back to your PCM, get a referral. That referral will go to A, B, and C, and then you can finally get this. As opposed to in the military, if you were to walk in and we suspect any teared or fractures, we say, hey, I just put this order in, go down the hall, get it done, come back, and we'll look at it. Yeah. So like,
Lickety split.
yeah. So the processes are just mind blowing. It's different. It's great because being in the military, we have to be ready for essentially anything that goes down. So getting these patients answers and letting us know what to do with these patients in turn has better recovery and just better outcomes for both the patient and ourselves. And so we know what direction to go into.
Speaking of directions to go to, you have worked at multiple bases. So I hope I don't get these wrong, but we have Lackland,
Mhm.
we have Eielson. Am I saying it right? Okay. And then Peterson. Are those the three different bases that you've worked at?
Yeah. So Lackland was in Texas. I was there for 3.5 years. I was actually born and raised in San Antonio.
Oh,
So
all right.
it really just felt like a different job. Really didn't
Yeah.
really feel any different other than, going and putting this on every day.
Yeah.
Um, and then from there, I was stationed in Eielson, which is in Alaska, for about 4 years. Super cold. Some
Man.
Yeah, it's hit or
Texas
miss.
to
It's
Alaska, that's a huge.
very much. Texas blows hot air, and Alaska gets to like -50 degrees, and it's very dry. So very, very two complete different styles of living. I was not, my wife and I were not prepared for it at all. It was a drastic change. And then we came to Colorado at Peterson Space Force Base. The Space Force is a new, I'm sure everyone knows now, it's a new branch of service that you can go into, but they are very limited in what they have. So, me as an Air Force member um, supports the Space Force for medical reasons, kind of like
Makes sense, yeah.
the Navy does for the Marines.
Yeah.
Um, Same models, different branches. But yeah, we've been here. We moved here about 3 months ago. We're loving it. The weather is great. Super bipolar over here, by the way. It'll be bright and sunny, and then rain for 2 hours, and then switch back to sunshine. So
Yeah. So you went from that hot Texas to freezing Alaska to now you have this one that's like, I don't know. I don't know
yeah,
what kind
it's
of mood I'm gonna be in today, right?
yeah,
But
but
hopefully warmer than Alaska.
oh yes, 100%. I haven't been here for winter yet, so we'll see how that goes. But yeah, looking forward to it.
Maybe you'll get that beautiful mix of everything that you want there in Colorado. I have some friends in Colorado and it sounds like it's a beautiful place to be, but I have visited once. I didn't have the best time, but that was because I was not feeling well when I was there. So it wasn't necessarily that Colorado was a
Yeah.
bad place to be. So what's it like going from base to base and kind of learning the new trends? Like, would you say it's, I know you said you haven't worked in civilian, but for me to go from one hospital system to the next, there's a lot of new things that I have to learn. So is it more seamless in the military, or is there still like a whole new culture that you have to learn when you get there?
Definitely a whole new culture. So PCSing in itself, by moving with this permanent change of station, is very stressful on not only you as a member, but your families. A lot of information, paperwork, picking up your whole life essentially, and just moving everything within sometimes 2 years time, sometimes 4 years. um, just has its up and downs. It's great because you get to explore certain parts of the country, or if you get stationed overseas in like Japan, Italy, or anything. It's definitely a culture shock when you go to those clinics over there, just because the way of living, the way Italy lives, and the way Americans live are just
Of course, yeah.
cut and dry. But yeah, so every clinic is different. I've trained in Center for Intrepid, which is people who have amputees, or there's, like I said, occupational settings. There's outpatient settings. We even have inpatient. And I think the real adjustment is 85 to 90% of the time, we do not get to choose where we go.
Mm.
Um, so we're kind of, hey, there's one day we're like, hey, you're going here, A, B, and C. And it's not until we get there that we figure out, oh, okay, I'm an inpatient, which is completely different from outpatient.
Oh
Um,
yeah.
yeah. So, and I mean, some are joint services. So we'll be working with Army or Navy at
Mm,
these joint bases in
interesting.
this one big hospital. So learning how each branch operates and how we train, even as far as like clinical competencies or just in the military in general, is a huge culture shock. But it's something that we have to just embrace and adjust to and just have that resilience. And um, yeah, it's definitely a big shock, but we learn as we go. Will it ever get easier? Probably not. We just kind of learn to roll with the punches. um, but yeah.
Yeah. I mean, I was just thinking if someone, I was mostly outpatient orthopedics for about 8 years, and I started doing acute care weekend rotations for the last couple years as I was transitioning into education for the most part. And if somebody had told me, like, you're going here one day, nope, you're going here one day, I think I would have a complete panic attack every single day. Because I'm
Yeah.
like, no, 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 I need to know. As a matter of fact, one time when I was doing the acute care weekend rotations, which was mostly orthopedics, I would say 90%, there was a couple of things intermixed in there. But one day they were like, hey, we're going to send you to the rehab, like the inpatient acute care rehab. And I about broke down because I was like, I don't know what to do. And so I've often kind of joked that the acute care inpatient rehabilitation was not my cup of tea. I was not very good at it. But just to think about how you don't always have that choice of where you're going to be and where you're going to go, that has to make you a really good clinician. Like you said the word resilient. Like you have to kind of have this grit and resiliency to be able to just kind of like change and go and be prepared for anything, right?
Yeah. Yeah. It's
Something
tough.
the rest of us could use.
Yeah. Yeah, it's tough. You'll always have members at whatever base or clinic setting that you go to there to support you and kind of try to make it as smooth as along the way, as they are able to and as you can adjust. But like I said, again, going back to like the civilian contractors that we have in those clinical settings are a huge help because if they know the game, they've been there. No one's telling them where to go unexpectedly on one day, so they kind of know like the in and outs. They've been there through so many physical therapists, which fluctuate quite a bit. Physical therapists in the military, they have anywhere from 1 to 3 year assignments, so they move more frequently than we do.
Hmm.
So having that contract PTA there for like continuity of care, they probably see more physical therapists than we do in 4Js. Just because if you have someone that works there for 10 years, they're like, oh, I've probably gone through like 15 providers by now. So yeah, they're a huge help with trying to bring us home and stay resilient on that aspect. So
Yeah, that's very interesting. So you had mentioned that you have multiple different avenues of training that you can go through and that you could be cross-trained in like occupational therapy and some orthopedic care. How does that look for you? Like, do you get to pick and choose some of the things that you want to be trained and competent in, or are these kind of like set things that you go through in your typical training protocols?
yeah, so every year we have to maintain clinical competencies, just like CEUs essentially. And some of those hard competencies are orthotics and splinting. So we are supposed to be trained on how to do like certain types of wound care, casks, thumb splints, anything like that. Um, as opposed to if we wanted to go occupational, we can, as if our clinic holds that. But we also have a program that will allow us to train and go sit for our licensure for CODA. For the orthotics, we also have a program. I believe it's I could be wrong, a 10 to 13-month program, also based out of Lackland. Lackland is a very huge, educated, driven facility over there. They deal with a lot of physical therapy students, a lot of students straight out of that tech school training go there as well to gain those clinical competencies. But that program, once you are done and certified in that, your sole job from a 4J becomes an orthotic technician. So your job is making whatever it is in needs of a patient. So it's pretty cool. So those are some kind of avenues, CODA and the orthotics aspect, that are voluntary. Everything else, splinting, like thumb spicas or anything like that, those are we have to maintain those every year.
Gotcha. Does that, is there an avenue that you've explored that maybe you feel more passionate about that? I mean, I don't know what your future plans are. And of course, you don't necessarily have to like break that out on a podcast, what you want to do in 5 to 10 years. But I mean, are there some things that you have, some trainings that you have taken that you're like, man, I could really see myself going in this direction in the future?
Yeah, trainings for 4Js in the military is very heavily based on where you're stationed. Here in Colorado, I have endless possibilities to go get trained on anything that I really want to, really, as far as, as long as it falls in line. But at my last base, Eielson, it's so secluded from everything. The nearest city was about 35, 40 minutes away. And then with snow, like a foot off the ground, it turned that drive into a easily 1.5 hour drive or something.
Just the thought of the snow makes me not happy.
Yeah, you would not want to live in Alaska. But yeah, I want to be a physical therapist a couple years down the line. Currently, my education background has been kind of like set back because of all these barriers that I've experienced with CAPTI discrediting our schoolhouse,
Mhm.
trying to go off base. So my timeline has definitely been pushed back, but I've tried to push through it. I'm currently working on my bachelor's, and the military actually offers a doctoral physical therapy program called the Army Baylor program. So that is also, unfortunately, at San Antonio. I would have to go back home.
You
If
just keep winding up in Texas.
I don't, it's destiny. I'm not sure. But yeah, I that's the plan. Finish bachelor's, apply for the program, hopefully get in. Air Force seats are very limited in that program. I think there's like only 4 to 6 out of 35. So I just had to try to maintain a competitive edge, and yeah, we'll see where I'm at in 5 years. Hopefully, physical therapist.
Yeah, yeah. Well, I have no doubt that you're going to be an excellent addition to the Army Baylor, right? Army
Yes.
Baylor DPT program. So I'm excited. What was one of the things that maybe kind of spurred you to choose that as a path? This is like a hot debate, and we talk about it a lot on this podcast. Like, do PTAs move on? Do they,
Yeah.
yeah.
I am. Don't get me wrong. I am very happy if I were to live out my PTA license career for the rest of my life. 100%. I think the the only factor that's driving me to become a physical therapist, specifically in the military, is that direct access to everything. It's I've just heard so many horror stories, the civilian side, and just runarounds through insurance companies or like referral processes, and I'm like, man, that sounds like a huge headache that I don't have to deal with if I were to go military side. Granted, if for some reason things don't work out, like I said, I am 100% happy about leaving my PTA license out through the rest of my life. But yeah, just finding, just getting to like the grits of why a patient feels a certain way, and we have those capabilities to do special tests, but even though we know we're confident and performing things, or we're like, oh, maybe this patient has this. Technically, the therapist is the final say. So just that moment of like, oh, I was right, kind of thing. Just kind of confirming your own knowledge. Um, just having that aspect. Um,
Mhm.
yeah.
Yeah, the autonomy to feel like you can provide the type of care that we all got into this field for. I think that's very frustrating for many PTs and PTAs on the civilian side that you sometimes feel like there's these barriers that you can't actually do what you want to do or what you know to be the right path for that patient
Right.
because you have a lot of things in the way. So I don't know, maybe you guys will see an uptick. I don't think that there's that many people who listen to my podcast, but maybe a few people will turn the military direction to come and have some of that autonomy that you all enjoy so much on that side. Um, so now you do take on other additional roles as well. So like there's these couple pieces that you were talking to me about, infection control for equipment and then patient advocate. Like are those also part of your typical training or are these like again a separate thing that you kind of can step into?
Yeah, so those are kind of things that we step into just in every clinical setting that we go to. Infection control, I feel like that's actually pretty standard across civilians as well. Equipment custodian, just ordering supplies. If
Mhm.
things break down, just putting in those work orders. Patient advocacy, it's kind of weird to do and perform at the same time. I'm not sure civilian side if a patient has an issue and or just just feels like they need to talk to something because they're not being heard for whatever reason. um, so myself, I'm the patient advocate for my current clinic. If I were to be the provider for that patient, and then the next week something happens, I have to switch hats and say, hey, like what's going on, like what happened. But we have alternates. The only thing is we're also seeing those patients, and if they complain, they're complaining to us about us in a sense. So it's kind of it's a weird switch. We have things in place. They can go to like the main clinic advocacy if they don't feel comfortable talking to us. But we always try to handle things at the lowest level possible and try to get what's right for the patient within reasonable standard of care practice. And it's a little different, yeah.
Yeah.
Um, some other additional roles, just monthly safety inspections, just both basically, don't leave work and go drive recklessly and,
Yeah.
make a thing because everything you do reflects on the uniform that you wear. So, just having those kind of talks with everyone in the clinic too, which is kind of weird, but at the same time, it's like you're an adult. um,
Yeah.
but yeah,
But probably healthy conversations to have. I mean, maybe we should have more of those conversations on the civilian side too.
yeah, yeah. Just basically slap on the hands, like, hey, you're not supposed to do this. Don't do it. So yeah,
Yeah, taking
nothing too exciting. Just basic clinical additional duties that we have to maintain. Where right now we have like a split schedule, so half the week we'll see patients, and then half the week we'll only focus on like administrative duties. So it's good with that, especially when we have the manpower to be able to do so. And again, that's where our contractors come in and help us out a lot and take that front load.
Yeah, yeah, that's great. I think it's interesting and fun to me to see like this equipment custodian. These are basic things that we do in the clinic anyways. It just has a fancier name. That's all. Yeah.
Exactly.
Yeah, we should all be taking care of our equipment and checking it for safety failures and all of those things. We just don't call it equipment custodian.
Yeah.
Maybe we should. Yeah.
Yeah.
So you are the new, brand new. You are the first PTA that has served in this role as the APTA Federal PTA Council representative. So congratulations on that. Yeah. So, what are your initial thoughts? Like, or is your initial thought, what the heck did I get myself into? Or are you excited to think of the opportunities that you're going to have to kind of bridge some of these gaps between military PTAs?
Yeah. when I first got into it, I was super excited about it. The way it was explained to me, I thought I could definitely. I still think I can some type of impact on it. Andrea, the federal section president, we had a couple conversations before I took the role on. She kind of let me know expectations, what her mindset was, which are very similar. I think we share a lot of similar viewpoints as far as how the federal side is going with their PTs and PTAs. So I think that just having those aligned similarities and goals with each other really motivated me to be part of this position. Um, at first, when I got it, I was excited, and then I was like, "Great, what do I do?"
Yeah.
But going to the APTA Leadership Congress in DC, just and hearing what everybody else did, and it just kind of was like, "Oh shoot! Like this is great information. Like I should be doing this stuff. I just have to cater it a little bit differently."
Yeah. Yeah.
Because yeah, everyone's advocating for their own state, as where I have to kind of be careful because we have PTAs all over the place
Mhm.
in America and even abroad, in like Germany, Italy, Japan. Those getting them involved, especially with the time difference, and just trying to reach out to them what they can and cannot do. Because, like I said, we still follow um, the direction of physical therapists to physical therapy assistants, but it's still under federal section. Some of those 4Js do have their license, so there are some things where it's like, well, hold on, let me take a step back because I'm in this state. If I'm licensed in this state, I can't do this.
Yeah.
But they can be licensed in Colorado and have certain capabilities, and then go to Texas and just have completely separate abilities. Like I know PTAs in Texas technically can dry needle, and I think that's the might be the only state that be able to do that. I'm not
Your
sure.
guess is as good as mine on that. Yeah. I don't know.
So just having those capabilities, if you do have someone that's um, a PTA that's licensed from Texas and they try to go to another state, and they like, oh well, I'm technically licensed in Texas, so I can dry needle. Like, hold on, where where are you right now?
Yeah. Yeah.
So trying to engage those different angles and aspects, and really trying to reach out to the Army and Navy. Their structure is so differently from what we have in our Air Force. Have they can be in the clinic for 6 months and go to be an optometry technician for 6 months, and then
Wow.
like just rotate throughout their
And
um,
I panicked when I had to go to inpatient rehab.
yeah. So
Like,
it's
you're gonna go work with the eye people next, like
and that's the weird part about the military. It's we it's just alternating every time. So even things with the Navy, so they're what they call corpsmen, I believe, at first, which they're medics, and they. I went to school at in Fort Sam with a couple of them, and um, they a year later reached out to them, see how they were doing, and they were like, "Oh yeah, like I work in women's health now," and I'm like, "Okay," I'm like, "Cool, like how did
great.
that happen?" And yeah, they have rotations too. They come in and out of the clinic. The problem is you can have those medics that weren't trained in physical therapy to be PTAs going into a physical therapy setting,
Mm.
and it's like, what can you do? You basically operate at equivalent to a PT tech in the civilian side. It's not like you can really do hands-on, joint mobilizations or even just correcting form really. Um, so it's definitely going to be a hard navigation, but I'm up for the challenge. I can't wait to engage with them, especially in Colorado. I spoke with the delegate rep here in Colorado, JJ Holmes.
Yeah.
He's been
Shout
super
out,
helpful.
JJ.
He's been super helpful with me,
Mhm.
and wanting to engage in military members that are in our profession to the civilian side and try to, do some type of trainings or, competencies, or even just try to help us out with, anything. So super excited to work with him going forward with all Army and Air Force and Navy here.
Well, he's a great person to have in your corner for sure. And I'm just sitting here thinking, I am the no, I'm not. I'm sorry, I lied. I am done as of June 30th. I was the PTA council representative for Ohio. I still attended, um, of course, a House of Delegates because of the timing that it fell. So now rolling off of that, but I think of my approach to the state. So I was responsible for representing PTAs in the state of Ohio. Well, that's pretty simple because I know the laws and rules. I teach laws and rules in my day-to-day job. So, like, to me, it's very black and white. I totally understand. And I'm aware of the challenges that the PTAs in my state face, as well as from a national perspective on the civilian side, right? But for you, you're dealing with multiple levels, you're dealing with rotations of different medical kind of training, that there might be people who are considered PTAs at that moment in time, but then roll off 6 months later and are in a completely different subset of
Yeah.
healthcare. So your approach is going to have to be so multi-pronged that you're reaching out to different layers and different. I just
Yeah.
can't even imagine
Yeah.
but if anybody's up for the challenge, it's Joel. I know it. I knew it within the first 5 minutes of talking to you.
Yeah. Thank you. I appreciate that.
Yeah. So, I mean, what do you see are some barriers, but also some maybe like low hanging fruit that you can maybe start immediately with as far as like engaging our military PTA members?
Yeah. I think the biggest thing is trying to get them involved in the APTA community. Just reaching out to, and that was another great reason why I really enjoyed being in DC for the time period that we went, because I got to meet so many people from so many states, and I'm like, oh, we have this base over there, or we have this base over there. So being able to reach out to them to see what kind of forums that they have open within the year or the coming years, and just telling those military folks like, hey, I have this contact for you. You guys should attend this seminar or summit, whatever the case may be, and just like go increase your knowledge, like go learn even more or learn from people, because from how I was trained was maybe complete. I know is completely different from how you were trained. So it's just getting those different takes and aspects of that education and just being involved with it with the PTA community, just to gain their knowledge and hopefully push them towards like, maybe I should get my license, and doing that military bridge program, that are so many, but yeah, just trying to get them engaged, and hopefully steer for licensing.
Yeah, I mean, I feel like there's so much that we can learn from each other. On the civilian side, takes about 2 years to get through a PTA program. And I'm sitting here thinking of all the ways that you have explained to me how your competencies and your training has been kind of divvied up and sectioned out. And to me, there's a lot of things that make sense as to why we can't mesh some of these things, why we can't kind of learn from each other on the sides that might make things a little bit simpler. But us on the civilian side, sometimes we like to learn things the hard way, but that's
Yeah.
neither here nor there. But
Yeah.
great. Well, before we go, first of all, I need to ask you what your plus point is. So the plus point is a traditional in this show, and this is where you have the chance to get on your soapbox. It's your platform, so you can like light a fire, you can start some advocacy effort, grassroots, whatever you want to do. What's something that you want the audience to know today? Your plus point.
I would say, if I, from what I met in DC, a lot of PTAs have turned to be educators, which is great. I would say for those who's listening, if you can engage with your school, to reach out to whatever military system that we need to, and I could be your point of contact for that if need be. to start that military bridge program with your school, if they offer that, that would be tremendous. Because I feel like that's one of our very limited factors of us trying to get our license, is that we only have one way to do it, and that's through Lake Superior, and it's one school. And if you go through that program right now, I believe just to get on the wait list is about 2.5 years just to even start. So that causes another delay, and everything. And it just keeps adding on and adding on and adding on. And eventually our motivation just kind of dies down. So getting more schools to promote that military bridge gap would be so helpful, and just encouraging for us to obtain our license. So yeah, that would be my viewpoint.
Hey, I couldn't have said it better myself. This is a mic drop moment. I met someone years ago, I think it was 2018 or 2019 at CSM, who was in your exact same position. And she had kind of given me an explanation of what the military branches kind of look like for PTA. So I have been aware of this for a long time. And I can tell you that that thought has never stopped going through my mind as an educator, is why we can't find a way to solve this problem, because I think that we can do it. So great, great plus point. I really appreciate it. And I thank you so much for your time, Joel. I think that this was a really great conversation to have a lot of really important details that needs to get out. I think PTAs need to understand and recognize what's happening on that opposite side that we don't see every day. We don't, as civilians, see that military side every day. So I thank you for your time. I thank you also for your service. We appreciate that, all you do. And thank you to all of our service members that are listening to the audience or listening in the audience from different military branches. We appreciate all you do as well. So thank you, Joel. I appreciate it. And we'll talk soon. Okay.
Thanks for having me.
Absolutely.
Thanks for listening to PTA Plus, the podcast for PTAs by PTAs. Subscribe, follow us on social, and share the show. Elevate yourself. This show is for educational purposes only. No clinical decision-making should be made from its content. See you next time.